Welcome, Namaste, and welcome to Dr. Shah's Clinic. In yet another video on erectile dysfunction, we are going to answer the question, is erectile dysfunction permanent? And can erectile dysfunction actually be permanently cured? A large number of patients who come to my practice with erectile dysfunction are actually quite worried and traumatized because they think once they have erectile dysfunction or ED, that their condition is actually permanent and they may require medications for life. But this is, very far from the truth because what basically happens, in almost 95% of patients, we can detect an underlying cause of ED and actually treat it very, very well. So the most common causes of ED are usually diabetes, hypertension, dyslipidemia, metabolic syndrome, anxiety issues, and sometimes, male sex hormone deficits or hormonal imbalance. So these are all conditions that can be clinically diagnosed as well as treated. So 95% of the time, there's absolutely no problem. But, however, in 5% of the patients, when a diagnosis of erectile dysfunction is made, the therapies may be long-term. So what basically happens is, so there are some clinical conditions, right, where, ED will be permanent and it will require medical therapy for a very long or a prolonged period of time. So let's, kind of look at these conditions. So the first condition is very, very advanced age. So in men who are, over 55 and who are over 60, most probably, no matter how fit they are, they may be able to have sexual intercourse, but erectile dysfunction will definitely set in. And this is a very normal physiological process. There's a functional decline in erection as an individual ages, and so taking medications and a small dose of tablets or medications called PDE5 inhibitors in small doses over a prolonged period of time is usually quite safe. There are safety studies relevant to this topic. So in much older men, so ED usually sets in and it's normally a part of age. Now the second condition where erectile dysfunction can be permanent if not treated is a condition called hypogonadotrophic hypogonadism, and in this condition basically what happens is the testis is not producing adequate testosterone because there's no inadequate central production of FSH and LH. So the brain produces FSH and LH, and the LH hormone is actually important for testosterone production. So what basically happens if there's no LH, the testosterone is not going to be synthesized in the testis, and these patients are going to have severe erectile dysfunction. And so for these patients, to maintain sexual function, we have to give them hormonal therapy. The third condition where erectile dysfunction can be permanent and quite troubling is a condition called Klinefelter syndrome. So in patients who have Klinefelter syndrome, it's basically a genetic condition, and there's an additional chromosome. It's called XXY. And what basically happens in these individuals is that the testis basically atrophies as they pass through puberty. So basically what happens is the testis is very small and shrunken. Again, there's inadequate testosterone production, and as a result, erectile dysfunction results. That's the third condition. The fourth condition is in some men, up to a particular age, the erectile function, sperm production is good. After that, after a particular age, they develop something called seminiferous tubular failure. And in this condition, basically what happens is the testis starts shrinking, sperm output decreases, and erectile function can also, actually go down. But of course, erectile dysfunction may not be seen in all men with seminiferous tubular failure, and is seen in some men with, a seminiferous tubular failure. But nevertheless, again, intervention is required and treatments are usually required. Now, the next condition where erectile dysfunction can be, supposedly permanent is in men who are morbidly obese with metabolic syndrome. So men who are very, very obese, who have a very high waist to hip ratio, who have obesity with a, BMI greater than 40 kg per meter square, and who also have metabolic syndrome, who have completely uncontrolled diabetes, uncontrolled hypertension, elevated, blood cholesterol levels. ED can be permanent unless or until all these issues have not been collectively resolved. So that's another condition. The next condition where erectile dysfunction can actually be permanent is in individuals who are clinically in severe depression. So both moderate to severe clinical depression can, result in ED, and in these men, erectile dysfunction will be long-lasting until or unless the depression is not resolved. The next condition where erectile dysfunction can be permanent is in men who have generalized anxiety disorder. So in men, some men are usually very anxious, they're very neurotic, they're quite anxious, and what basically happens is they're so worried all the time. So they have an issue, they cannot cope up with life, comfortably like, men who are, less anxious. They have generalized anxiety disorder unless the anxiety is not resolved, because basically when a person is anxious, it's the sympathetic nervous system fires up in the individual, and when the sympathetic nervous system fires up, erection basically goes down because vasoconstriction happens, right? So the blood flow to the organ narrows, actually becomes reduced. So erection is not going to sustain. So generalized anxiety is a disorder which is unresolved, can also lead to ED, which is actually quite powerful. So these are a few conditions, where ED can be, kind of long-lasting and pressing and also quite irritating. So we can manage all these conditions, so don't worry. ED, no matter how severe, no matter how permanent it may seem, is actually treatable, curable as well as manageable. So do not worry. I hope you enjoyed this video. I hope you found the video very informative. Please like, comment and subscribe. Share this video with all your friends and loved ones. This is Dr. Shah. I'll see you soon with another video. Barak.